back to the Morning Blend. If you think you'll be sidelined after problems with your knees, hips, or shoulders, think again. Our next guest is a board-certified orthopedic surgeon who specializes in treating those areas of concern to get you back doing what you love.
That's right. Dr. Michael Crovetti is the founder of Crovetti Orthopedics and Outpatient Surgical Recovery Suites. He joins us with patient Jeff Foley. He's the director of tennis at Darling Tennis Center. Good morning, gentlemen. How are you?
Good morning.
Good morning.
So hip and knee replacements are obviously becoming more and more common in our middle-aged athletes. What are some of the most common examples that you see?
Yeah, the fastest growing segment of hip and knees is 45 to 65.
Wow.
And these are athletes that are playing. Most of the sports we see are tennis or racket-related sports, tennis, racquetball, squash. A lot of cyclists. You'd be very surprised. A lot of cyclists, mountain bikes, even some skiers, believe it or not. So we see a wide range of things people are doing at that age.
And you performed surgery on Jeff here. What did he have done and what happened there?
Well, he had a bad hip when he was 16 years old. So he had a surgery when he was 16. And over time, that led to wearing out of his hip as opposed to his other hip.
Yeah.
So as he got older, and we know that most people under the age of 60 that require a hip replacement had some problem when they were a child. It's not always clear, but Jeff's was certainly clear he had surgery when he was 16.
No question. So what exactly was the procedure that you did?
Well, he had some pins put in his hip, and they were a lot of fun to take out. Thank you.
Do you just do the hammer and pull it out?
Only in there 40 years. No big deal.
Kidding.
But we took some pins out of his hip and gave him a nice new hip.
That's amazing.
So it went fantastic.
And Jeff, how are you feeling today? And tell us what your recovery was like.
I feel great today. The recovery was actually quick. It's amazing how quick you're up and walking around, and they have you exercising and you know, keeping the joint moving. So it's a pretty incredible process of how quick you are up and going. I was back on the court teaching 4 weeks later, which is amazing.
Wow.
And so it's just progressed from there better and better.
Let's talk about your mobility before the replacement and now. I mean, it must be night and day.
Yeah, my range of motion had really deteriorated, especially in the last year or so. My hip was aching. It was hard for me to teach. It was hard to sleep at night. It had gotten where it ached at night, and you know, started taking more and more Advil to try and sleep and try to get through my day. So it's so much better now. No pain in my daily work routine or, you know, sleeping, stuff like that.
That's
Things you take for
fantastic.
granted is.
And where do you teach tennis?
I'm the director of tennis at the Darling Tennis Center.
Awesome.
So you obviously wanted to get back on your feet very quickly so you can get back in the court to teach your students.
Absolutely.
Well, we had no choice to get him back. He teaches my daughter. So
Oh, wow. So there you go.
so we had every incentive to make sure this surgery went well and get his butt back on the court.
No, Dr. Crovetti has been saying it's a beautiful facility. It's really not like your normal hospital environment. I mean, you must have found that very welcoming.
Oh, absolutely. I mean, the idea of having the surgery and then being right there in the recovery center and just seeing that center, how well it was laid out and how professional it was, yes, there was really no option, you know, of anything else. Yeah.
And obviously, Doctor, you did that strategically to make sure it was a comfortable environment for people to have the recovery after their surgery.
Well, he's young. He's not sick. He did need the hospital care. His surgery was 35, 40 minutes. He's up and walking within 3 hours in our center. So all of our staff was about Jeff that day.
That's awesome. So for people that are watching, they might be pushing off surgery, living with the pain, what do you say to them? Why should they come in?
You know, I think there's a lot of fear. There's a lot of fear of the hospital a little bit in that younger age group. A lot of fear of the pain. We have an under 5 program. We always keep your pain under 5. So knowing that your pain's going to be well controlled, you're going to be up moving in 3 hours, and you're going to be back in your sport in 4 to 6 weeks, a lot of people are going to make that decision to move forward with hip replacement.
And it's so important for the physical therapy portion. A lot of people blow it off, but that's part of the recovery process as well.
You know, any athlete benefits from physical therapy. Any athlete benefits from range of motion, flexibility, strengthening. You know, it's no different than anybody that has a hip or a knee replacement to go to physical therapy.
Absolutely. So if people want to reach out, how do they get in touch with you?
Well, try our website, I guess. That's the best thing. There's about 70 videos. I answer a lot of questions. I ham it up a little bit. It's CrovettiOrtho.com.
Awesome.
And how's his daughter at tennis?
She's an awesome tennis player.
Number one in the state.
Ooh,
No kidding.
Really?
Wow,
Nice.
brush the shoulders off. Well done. Very nice. It's a pleasure.
My wife was a good tennis player.
There we go. All makes sense now, and a great coach as well. Thank you so much.
Thank you.
It's great having you.
Thank you.
Congratulations. The outpatient surgical recovery suites, they're located on Horizon Ridge Parkway in Henderson. And for more information about them, you can just head to the website or call the number on your screen. They're also on Facebook.